So Diane's all numbed up, and we clearly mark the areas where we would like to have the bulk of the product confined. If one is pre-injecting prior to product administration without really delineating the areas of product, you do wipe out or obliterate some of your landmarks for product distribution. So I'm kind of a big advocate of making sure that we kind of know exactly where we want to go. And what we're going to do is inject this purlane first, like we discussed before, into the deeper tissue. This is a more heavily cross-linked hyaluronic product, and it's going to help get a base or a foundation, if you will, upon which we're going to layer some of the Restylane product. There's a variety of different injection techniques that can be done here. Again, you can do kind of a linear threading technique. I tend to be more of a serial puncture advocate. I think it just gives me the ability to ensure exactly where I want this product to go. So that's purlane in the deep aspect of that left fold, and we're going to do the same thing on the right-hand side. Purlane can certainly be used in the more superficial aspect or less deep aspect of the tissue. It just tends to be a little higher likelihood of post-procedural lumps and bumps. After, of course, we inject the purlane, I'm going to just put your head straight up there, Diane. I'm just going to give just a little light roll of the area. This provides a little bit better opportunity for the purlane to be more equally distributed in the base of the area. And then, of course, what we're going to do is we're going to inject our Restylane into the more superficial aspect. So we'll be layering that over the top. We'll come along, and again, you can do this as a linear threading technique. You can but this injection is very much in that superficial dermal layer. And after we have adequate volume of product in the tissue, and again, it's our opportunity to smooth the product, I'll send the patient home with an ice pack. My personal approach, the more you ice it, I think the less swelling patients have to put up with post-procedure. And I also think to a significant degree it also limits the amount of bruising. For those people that are needing to get back into the workforce without any stigma of having had the procedure, I think the pre-procedure use of arnica and bromelain is a nice adjunct, kind of keeping their level of bruising to an absolute minimum. Kind of feel the area, massage a little bit against the upper dentition. After I felt everything and I think it's nice and smooth and uniform, then we're go ahead and let Diane go.